of recurrent urticaria under the expert guidance of Dr. Suresh Nadarajan, consultant pediatrician and allergy specialist. Here we have a boy, 7-year-old boy. He was well till 3 years, after which he developed recurrent episodes of urticaria and angioedema. Twice, he had severe anaphylaxis on consumption of pizza and cake. There is no history of allergic rhinitis or wheeze and no family history of atopy. For the above complaints, he was evaluated by the referred pediatrician and found to have eosinophilia and elevated IgE levels. But his thyroid profile, C3, C4, ESR, CRP, and urine routine were normal. Considering the above scenario, the possibility of food allergy was considered and child was advised to go for food IgG test locally. The report showed significant allergy to cow's milk, sheep milk, egg white, and casein, and no significant allergy to nuts. So, the child was advised to avoid milk and egg. Despite avoiding milk and egg, the episodes recurred. So, he was referred to allergy clinic at Rainbow for allergy skin test. Here at Rainbow Allergy Clinic, the child was well looking and he had no rashes. So, we stroke his forearm with a ruler and he developed dermatographia. So, what we are seeing on the screen is dermatographism. So the provisional diagnosis for this kid is chronic urticaria with dermatographism. So can we proceed further with allergy skin test for this kid? So the answer is no. We can't do allergy skin test for this child, and allergy skin test should not be done in children with recent history of anaphylaxis, dermatographism, and severe eczema involving all over the body. Here, the child has both dermatographism and recent history of anaphylaxis. So, allergy skin test should not be done. But the child was referred to Rainbow Allergy Clinic for allergy skin test. But allergy skin test should not be done. How can we proceed further? So we proceeded further with component resolved diagnosis, and the report showed negative for milk and egg. So, and it showed positive for walnut JUG R1 and R2. So this is a case of walnut allergy. So walnut allergy, Juglans regia, has 7 components. Among these 7 components, JUG R1, R2, R4, R6 is associated with more severe reactions. Here, the child is positive for R1 and R2. Hence, it is correlated clinically also. Case on following the case, the child is on strict walnut avoidance and he's allowed all other foods. Now the child is doing well, and for the past 2 years, he has no urticaria, angioedema, and anaphylaxis. The general approach to food allergy is always a 4-step approach. Step 1, detailed history. Step 2, focused clinical examination. Step 3, allergy skin test, which is gold standard. Step 4, oral food challenge. And only in certain difficult cases, allergy blood test is advised. Allergy blood test, we have IgG, IgE, and component resolved diagnosis. Which test to choose? First, let's see IgG. Due to lack of evidence to support its use, organizations such as American Academy of Allergy, Asthma and Immunology, even the Canadian Society of Allergy and Clinical Immunology have recommended against using IgG blood test for food allergy. Next, we have IgE test. Though it is a valuable test, even it has few disadvantages, mainly false positivity due to usage of impure allergen extract and even in patients with very high IgE levels. So it should be done only in certain selected cases. Next comes component resolved diagnosis, which will be the future for the food allergies. However, It is not easily available in Indian scenario. It checks most of the allergen component and the diagnosis is very specific. It helps children with food allergy, anaphylaxis, latex allergy, and respiratory allergy. So the key message of this scenario is skin prick test is the gold standard test for allergy diagnosis. There is no role of IgG food allergy blood test. Role of IgE blood test only in certain selected cases of food allergy. However, component resolved diagnosis is the future test in food allergy diagnosis. Thank you.
Thank you, Dr. Preeti. That is very nice and crisp presentation. Thank you very much. And I think we are able to finish on time and well ahead because we had just probably one or two less presentations today. And let us just take some questions, which is here. And the first question is to the presenter with Missy. The question is, why do you say respiratory issue was not much when you have to ventilate for such a long time in this child with Missy?
So the child actually initially presented with pneumonia and the complications ARDS in the form of persistent pneumonia, ARDS with PEEP and pneumothorax. Along with that, child had also other system involvement like CVS, AKA, pre-renal AKA, and critical illness polyneuropathy. So those causes can also be attributed to the prolonged ventilation and followed with tracheostomy.
So I think the message you're trying to say is other things which actually added to the prolonged stay rather than only the respiratory issue. That's right. Thank you. And the Surya, are you there? Is chronic diarrhea a feature of Niemann-Pick? Surya?
Yes, sir. Yes.
Is chronic diarrhea a feature of Niemann-Pick?
No, sir. No, sir. In our case, this is the unusual presentation for our baby, sir. That's why he took care.
Okay. Okay, that's usually an unusual presentations on Niemann-Pick. Usually we don't. That is the reason we ended up doing the other GI workup also. So what was the type of skin rash in this child Niemann-Pick disease, and what was the cause of rash? I will take that answer. Actually, I will give the answer. Actually, the child presented the palmoplantar rash, and there was no scalp lesion, and this was more of a macular rash, and that was the reason of the GI manifestations of diarrhea, etc., and poor weight gain. We have to think in terms of also other diseases, particularly Langerhans histiocytosis, because we had a child, somebody like this exactly. And but then the skin rash is not very typical in Niemann-Pick disease as well as we have reviewed the literature. So that is the reason we have to rule out the other chronic GI conditions. And then when the parents, family were able to have a liver biopsy done, we were able to get it done. And because the child did have coagulopathy also, so we have to go for a left lobe approach. And then we were able to confirm the diagnosis of Niemann-Pick. Yeah. And I think I myself want to ask this question. Dr. Tyagarajan asked this question. Component resolved diagnosis. Some more details, Dr. Preeti. What is exactly is that? You did mention that, but you haven't given the details. Can you say about that? Oh, sorry. Okay, it's Dr. B. Ramachandran sir is asking this question. Okay, fine. Thank you. And what is this, Dr. Preeti or Dr. Suresh? One of you just, can you just clarify something about component resolved diagnosis? Is Dr. Suresh there or Dr. Preeti there? Suresh, are you there?
Sir, am I audible? Hello?
Yes, you are audible now. Yes, please tell us something about that interesting terminology, component resolved diagnosis.
Yeah, component resolved diagnosis is basically a blood test actually, which is very much useful in the diagnosis of food allergies. And especially when the patient's presentation is anaphylaxis, it will be very, very useful. It is a very specific test. That's what I want to tell you. And why it is specific is it checks the components of the food, specific components involved in the food. For example, to explain a simple way, if a patient has a milk allergy, and if I do the allergy skin test, I check for the milk protein. Okay, I'm not checking for any components. I check for the milk protein. If it is positive, we'll tell us a milk protein allergy. Similarly, when we do for specific IG for cow's milk, we are checking only for milk protein, not for the components. So either by doing a specific IgE test or by doing a skin test, we are checking only the milk protein. But in component, we check for the presence of lactalbumin, lactglobulin, and for casein. So if a child is positive to any of these three things, then we will again label this child as a milk allergy patient. The more important advantage is it also tells about the severity of the food allergy reactions also. For example, a patient who is positive to casein, I can tell the patient this will be lifelong allergy for you and you cannot outgrow it. If lactalbumin, lactoglobulin is there, they will outgrow it. Similarly, for walnut, for peanuts, for other foods also we can check. The main problem is it is very expensive test and not at all available freely in most of the centers actually. So we have to send it outside through research purposes, and we are doing for limited patients. These patients, because presentation is anaphylaxis, and we are not able to clinch any diagnosis with the available test, and skin test was also not possible to do because of presence of dermatographism. We went ahead and proceed with the component test, and finally we clinched the diagnosis.
Thank you. Suresh, just to have the, so is this IgE to those allergens? What you mean IgE to casein, IgE to lactalbumin? That's what you're talking?
Yes, yes, yes.
Okay, that's fine. Another thing is, walnut is a bit an unusual allergy. It's a tree nut. In this child, did he have any cross-reactivity to peanut also? Or did
Yes.
the child be able to tolerate peanut very well without any issues?
Yes, this child has, this is the case we are going to publish shortly because it's a little different. Usually, walnut is associated with pecan, PECA, and that is another tree nut actually.
Yes, yes.
Walnut sometimes can be associated with peanut, but this child has only a pecan association, but there is no peanut allergy, no other hazelnuts or negative actually for the patient.
Almond, everything negative.
Everything is negative.
Oh, that's very interesting, isn't it? Thank you. And Dr. Janay Shankar asking a question: do you get walnut with pizza?
No, I don't know. See, basically, this patient they came here to test actually. Sir, will you test for cake allergy? Cake allergy and pizza allergy. That's what they came to my clinic and asked me actually. Basically, in any allergy, we can only check for the components of the food. And we thought possible nut may be possible. I had suspicion about nut actually, basically. But finally, it turned out to be a walnut allergy.
And that's a specific IG to walnut. That's what I'm taking.
Yeah.
Okay, thank you. Thank you. And that's very helpful. Thank you. And has anyone got any questions here, please? And the one thing I just want to give a comment about the code. Somebody mentioned about the treatment algorithm about essentially hydrolyzed formula straight away to amino acid formula. I think if you are not having a very significant weight loss, you should start with essentially hydrolyzed formula rather than jumping to amino acid formula. That's my comment actually.
One question, sir.
Anybody has got any questions, please?
Yes, sir. Sir, is there any role of probiotics in urticaria?
Sir, as per the available recommendations and guidelines, there is no specific role of probiotics in the treatment of urticarias actually. So there is no role of, for example, we have primordial prevention, primary prevention, secondary prevention, tertiary prevention. When a disease started occurring and you're giving probiotics has no role actually. But there are some proofs for primordial. Initially, you take it for during the antenatal period, mother with allergy, you give something, some beneficial effect, but actually there are no recommendations to use in any patient with allergies with probiotics to for a benefit of the symptoms, especially for the urticaria.
Thank you. And any comments from any of the senior pediatricians, Dr. PRC sir, Dr. Janani madam, and Dr. Elilasi, I don't know if she's there, or Dr. Shyamala, anyone wants to have any comments, any particular questions? Otherwise, we will wind up.
Yeah, I think it was a very well conducted meeting. Vishwanathan, I think you were very strict and all of them stuck to time. I think this discipline should continue. It was really well hosted. Thanks to Sharath again for the Zoom link and for the coordination with the team. I think the next meeting will be on February 16th and it should be hosted by SMF team.